Hey guys, it's Tony here and welcome back to my YouTube channel. If this is your first time checking out my channel, guys, welcome. My name is Tony. I am an RN and my channel is all about women's health, lifestyle, motherhood, and much more. So today's topic is high blood pressure, also known as hypertension. I decided to talk about high blood pressure today just because I tend to know several people who do have high blood pressure. And did you know that women who do have high blood pressure have 3.5 times greater chance of having heart disease than women who don't have high blood pressure at all? So that's a fact. And I just decided to do this video as well just because a lot of people out there have high blood pressure and have no idea. So what is high blood pressure or hypertension? So hypertension, it's when the blood pressure in your arteries increases, right? So therefore increasing your heart contraction. So it makes your heart work harder than usual so that it's able to send blood to the rest of your body. Okay. So what is the normal blood pressure? 120 over 80. Okay, so 120, the top number, it's when your heart squeezes. All right, okay, and then the bottom part, the 80, is when your heart just kind of relaxes. So what are some of the risk factors of high blood pressure? Family history. So if you have a family history of high blood pressure, chances are that you could end up having it if you don't do anything about it. Okay, being overweight, being diabetic, drinking alcohol and smoking, and if you're just always under a lot of stress, you are a high risk of having high blood pressure as well. And so what are some of the signs and symptoms? Okay, so hypertension, it's actually known as the silent killer. All right, so the reason is, once again, a lot of people don't really know that they have high blood pressure because they don't feel anything. They feel fine. Your blood pressure could be so high and you might not even feel anything. Once again, that's why some people go to bed and not wake up at all, because they reach that phase, that critical phase where their blood pressure gets so high, which causes complications in their sleep, not feeling anything, and then they pass. I know it sounds scary, guys, but it is a reality. It does tend to happen. Okay, so what are still some of the signs and symptoms? So some people experience headache, blurred vision, dizziness, and nosebleeds as well. Okay, but once again, sometimes people don't have any signs and symptoms at all. When do you see the doctor? So you want to see the doctor if you are the type of person that falls under the risk factors. Okay, so if you already have a family history of high blood pressure, you definitely want to go see your doctor, just once in a while. I will say maybe every 6 months, just to check your blood pressure, just to make sure that you don't have it. So how is high blood pressure diagnosed? High blood pressure is diagnosed when the doctor has you check your blood pressure, monitor your blood pressure for several days, and your blood pressure doesn't drop at all. It stays at a higher number than normal. So usually, let's say around 140 over 90. And we said that the normal blood pressure should be around 120 over 80. Okay. So if for several days your blood pressure has been steady high, then the doctor will go ahead and diagnose you with high blood pressure, and sometimes there are more tests that has to be done. Okay, all right, so what is the treatment? Okay, so when it comes to treatment, it really depends on the individual. All right, so let's say if the doctor diagnoses you with a slight high blood pressure and then you're obese or just overweight, the doctor's gonna decide to maybe just encourage you to change your lifestyle. So eating better, cut down on sodium in general, and physical exercise. But then if your blood pressure is high at a point where exercise and diet won't really help it that much, then the doctor will go ahead and give you medications for it. Okay, and as long as you have that balance, then you will probably just stay at that one type of medication for some time. But then over time, let's say if your condition just gets more critical, where your blood pressure gets higher and the medication is really not helping you so much, then the doctor will give you a combination of different medications. Okay, so that's that. And so once again, diet is key. So watching out the things that you eat. You want to cut down foods that are high, super high in saturated fats, high cholesterol, high salt, and you also want to cut down smoking. If you smoke, you want to cut down on alcohol. So just things like that. It does take time, guys. It might not happen overnight, but as long as you're doing something about it. All right, so what are my recommendations? Okay, if you're somebody that has any of the risk factors that I mentioned, guys, you need to be in power of your body. Okay, one thing that I can recommend is by investing on a blood pressure cuff. It's your body, you got to do it for yourself because you already know that you're a busy person, you're a busy mom, or even a busy dad. Okay, so a lot of times we don't even have the time to go see a doctor just for a physical checkup. All right, so the least you could do for yourself if you have one of the risk factor is get a blood pressure cuff, check yourself even once a month. You don't want to wait to be diagnosed with high blood pressure for you to buy a blood pressure cuff. The sooner you invest in one, the sooner you are in control of your body, the better, because that way you know your norm. Okay, so you want to log it, and then just keep track of the days that, let's say, you end up having a headache, a severe headache, or anything like that, nosebleeds if you happen to have one, if you just had a really stressful day, or if you just weren't really feeling like yourself. Those are the times that you really also want to check your blood pressure. Okay, so if you do have, let's say, one of the risk factors that I mentioned, check your blood pressure at least once a week. That's the least you could do for yourself. Okay, you're taking care of your body, you are in charge of your body. All right, so as time goes on, you already have your blood pressure logged. All right, so you will know exactly when it's off. And it also helps the doctor, right? Let's say, God forbid, you still end up having high blood pressure, and then the doctor will be happy to see those numbers, recorded. One thing for sure is that a lot of people tend to be in denial. So they do know that they have a family history of high blood pressure. They smoke and stuff like that, but yet they don't really do anything about it. Now, talking about cuffs. When it comes to buying your cuffs, I got mine from Amazon, and I actually got it for the purpose of my clients. I worked in the community, and so I just got a basic blood pressure cuff for my patients. But if you do decide to get a blood pressure cuff, I would recommend that you go to your pharmacy, your local pharmacy. It's probably the best place that you can go and get advice on a good blood pressure cuff. And not all blood pressure cuffs are good, okay? And so once you do buy your blood pressure cuff or your blood pressure monitor, I should say, then you see if you can go to your doctor and just have them test it to make sure that the accuracy is good. Okay, especially if you're buying a brand that's really not recognized. I'm gonna put a list of the brands of blood pressure monitors that you can buy that's actually recommended by Hypertension Canada. So which are usually found, I mean, you can find it on Amazon, but like I said, it's probably best that you go to your pharmacy, because at the end of the day, you also want to buy a monitor that has a cuff that's suitable for you, because sometimes these cuffs can be super big for you if you're a slim person, or super small if you are on a heavier side. So it's important that you get the right cuff size, just because if you buy a size that's too small, then you might end up having a false high reading, and then if it's too big or too loose, then you might end up having a false low reading. Okay, the next thing I will show you how I check my blood pressure, and I also check my husband's blood pressure, and so I will show you what I do. I mean, if you don't have anybody to help you do it, you can always do it by yourself. I will do it by myself first, and then I will go ahead and do my husband's, so that you see exactly how it's done. All right, so let's get going. All right, so right before you take a blood pressure, you want to make sure that you're feeling rested. Make sure that the cuff is the right size, like I said earlier, and in the right place. Keep the cuff arm on a flat surface like a table and at a heart level. And you want to sit upright. Make sure that your back is straight and your feet flat on the floor. And try not to talk. All right. Leave a comment below if you would like me to make a video of how to take your blood pressure at home. The reason that I'm showing you how to do this, it's really just to show you that it's very easy and you can do it yourself. But then if you have somebody that lives with you, they can always help you do it. And it doesn't take that long. All right, guys, so that's it for today. I hope you learned something new. Please, please, please get on it if you're not on it. Monitor yourself, get to know yourself. So if you learn something new, if you feel like this was really informative, go ahead and share with your family members, your friends, our coworkers, whoever is it that you know. Just share the video. Don't forget to like, and don't forget to subscribe if you haven't already. All right, guys, I'll see you next week. Bye.